afternoon and welcome to the Microsoft track of this COG Extra event. And the title of our session this afternoon is From Sprint to Marathon, Embedding the Healthcare Transformation that we've seen through COVID-19 for long-term change. So I'm going to pass you over to my colleague Stephen Docherty, who will introduce the session and himself, and then there'll be an opportunity for Q&A through the Q&A section. Thank you very much, and over to you, Stephen.
Okay, thank you, Shona, and good afternoon, everyone. And thank you for joining this fireside video chat, exploring the rapid transformation across the NHS throughout COVID-19 and what this may mean for long-term change. So we have some time at the end of the discussion for Q&A, as Shona mentioned, so please pop them in the Q&A function and we'll get to them. So my name is Stephen Docherty and I'm the Industry Executive for Health at Microsoft. In my previous role, I was a CIO at a London NHS trust providing mental health services across several London boroughs. I have a background of working in high-tech industries. And with me today, I have Ashish Goel, the Managing Director for Health in the UK for Accenture. Ashish, may I ask that you say a few words to give people an idea of your role and your previous experience?
Thank you, Stephen. First of all, I must say it's a pleasure to be here. It's a topic close to my heart. And I always love to have a good conversation on it. I lead the health business at Accenture in UK. Previously, I've worked extensively across life sciences, essentially big pharma, med devices, industry across UK and internationally, as well as retail consumer health business. So quite a spectrum, but if you look at it across the whole end-to-end continuum of health and well-being is what I've been doing in the last 25 years or so.
Yes, thank you very much for that, Ashish. So just to set some context around this conversation, we all know that we have seen and heard of various rapid changes in technology adoption across the health sector. However, the challenges remain and are increasing. You may have seen the BBC news article yesterday that tells us the NHS is facing a triple whammy of rising COVID-19 cases, a backlog of treatment and reduced capacity due to infection control measures. Hence the importance of tech adoption that can help address some of the challenges. And this is what we'd like to explore further in this conversation. So Ashish, with your background in life sciences, I would imagine there was close proximity to the health sector. And given you've recently come back to the sector in your role as MD of Health, what has really been noticeable from your view of the health sector over the last few months as we are going through this pandemic?
So like many others, I've watched with interest the robust discussion that COVID-19 has sparked. And this discussion has been across three specific dimensions of this story. Faster clinical outcomes, broader population health, and overall digital readiness of the health infrastructure. And it's interesting, we recently published a research report with the outcome of digital health patient survey. We reached out to a broad range of citizens across England and outside UK as well. And the reality is that pre-COVID, digital health adoption was beginning to stall. But what I mean by that is we were kind of reaching a point where both administrators as well as patients were using digital, but to a limited extent, and there were reservations around data privacy and effectiveness. But this trend has been completely flipped on its head over the last 6 months. So let me put some color into this. So I talked about three things, if you recall: faster clinical outcomes, population health, and digital readiness. So the first one, for instance, if you think of it, the pandemic has highlighted the need to deliver from faster clinical outcomes through closer cooperation between pharma companies, academias, and healthcare providers. We have been following the news with great interest around the vaccine development that AstraZeneca, Oxford, have been doing very closely working with NHS and other healthcare systems across the world to fast-track clinical trials. And that's kind of one big encouraging win out of the closely coordinated set of actions that the industry has come together to actually create faster outcomes. I hope it makes sense, and there are many such examples as we look through the COVID journey over 6 months.
Yeah, that is definitely encouraging to see, and hopefully we can see something happening quite soon in that respect. I think we're all waiting for that. Earlier today, we heard from Eric Topol, who published his review for the NHS in February 2019 on behalf of Jeremy Hunt, who was the then Secretary of State for Health. And I keep referring to this simple phrase that Eric Topol came up with, the gift of time, and meaning the adoption of technologies that give healthcare staff more time to care for patients. For me, there has never been a time more in need than now. And so for me, the adoption of technologies like automation, AI, and clinical speech recognition is important to alleviate that burden on clinicians. So I suppose the question, Ashish, is do you think that these technologies are something that can be more widely used? Have we turned the corner where we'll see more human AI collaboration to help give the gift of time back to clinicians?
Absolutely, indeed. And for me, the core of this is around simplicity. Simplicity is really the key to faster adoption and therefore value realization for both healthcare providers as well as patients. So, and you touched upon a number of examples, and I did read Eric's report, and it's a masterpiece. So let me give you some examples. So for example, if you think of combination of human plus AI as a game changer, it doesn't need to start with the most complex use cases that sometimes we run the risk of imagining in the kind of sci-fi kind of a space where the actual treatment of patients is somehow being done by robots. That we are not there yet, at least. The simplest examples create the ability for healthcare professionals to make more informed decisions at the point of care, with insights that can be generated with the tech, wearables, the data collection coming from everywhere, or improving supply chain effectiveness. If you recall, in the early stages of pandemic, we saw a crisis around PPE or testing kits, which is still being talked about in the media. Now this is where again brilliant tech comes into play, and through predictive modeling techniques, having the ability to predict where the next hotspots could develop, and getting the resources which always have to be optimally used. It just reduces the burden on healthcare system, and also allows the healthcare providers like NHS to really focus the critical resources where there is the most critical need. So that's my take on this.
Yeah, interestingly, you mentioned around the issue with PPE, and it brings to mind a recent story that we had in the news around the use of our HoloLens. So we're seeing new ways of delivering care. So the use of HoloLens by James Kinross, who's a consultant surgeon, and his team at Imperial College Healthcare Trust, when they realised that their wards were being swamped with COVID cases, and they had challenging times for securing PPE at the time. So with the use of what's called remote assist, other clinicians could actually view what was going on in real time. So they were thus saving on the PPE. So this was all done rapidly between James's team and the Microsoft HoloLens team. And I suppose, therefore, building the trust between the two entities that enabled that innovation to happen is something that I guess that the sector needs to work in partnership with tech companies to work on, I suppose. But yeah, I think you just brought that up for when you mentioned PPE, so thank you for that. So I suppose coming back to the point around the use of human and AI collaboration, we also noticed an increase in the uptake of Microsoft's HealthBot. So that was configured for COVID. And for example, since March, we've seen more than 1,600 instances of COVID-19 bots, delivered across 23 countries or so, because those health organizations have been using this service to create COVID-19 self-assessment tools to reduce the strain on emergency hotlines. And so, I think we all understand that we have been seeing the changes in tech adoption in the health sector. And one that also comes to mind is the rapid deployment of Microsoft Teams that Accenture, Microsoft and NHS Digital worked on together to enable NHS staff to communicate and collaborate from anywhere during the pandemic, which was a great piece of work. I don't know if you want to comment on that, Ashish.
Yeah, you're absolutely right, Stephen. I would actually build on on that by saying, so Teams infrastructure that you talk about, so we work together to bring 1.2 million frontline workers in what was really a game changer mode of collaboration when they were really tied on the bandwidth, and we did it in just flat 1 week, and that's a phenomenal outcome. Now, having said that, that's just the start of the journey. If you think of virtual consultation, and again, the survey I talked about earlier suggests that during peak of pandemic, close to 80% of the GP consultations moved to virtual. And virtual doesn't again mean sophisticated applications. It could also mean you talking to your GP on phone, but yes, gradually based on the need, you could do a video call. You could actually do further consultation on the digital platforms, and Teams can be really a key enabler infrastructure for these 1.2 million frontline workers for virtual consultation, remote monitoring, especially for long-term condition management cases. There's so many further builds that we can do on top of this wonderful core capability that will benefit the patients as well as NHS in long run.
Yeah, and one thing that just came to mind there when you mentioned Teams is that I like this story that at the beginning of the pandemic, I happened to see on Twitter, it was maternity nurses over in Northern Ireland. So mothers with a newborn child, all right, so having to be at home and under lockdown as well. So, it's even more difficult for them. So they created Teams channels so they could have videos, they could join up with, women in the same situation that have just come through this. So it's another great use of Teams. And I think that, there's so much we can do. I do agree with you. There is so much that we can do to help. And we owe it to the health and care sector to help them to adopt this technology even further, because if you can collaborate locally, regionally, nationally, you can collaborate across your health sector, your health economy, then, this is going to help us all. So I suppose on that point, Ashish, what do you think are the challenges that we need to consider, or the conditions that need to be in place to continue down this path?
There are a number of things we need to watch out. So if you think of digital health and usage of technology, we have to do it with a lot of care. We have to do it with a lot of care so that digitally less enabled don't become excluded even more. So whatever proposition, capabilities, etc., that we build as a part of a robust healthcare system, it has to be inclusive, it has to be accessible, it has to have sufficient consideration of the diversity of population, and so that's number one. Number two, I would say. See, electronic media also produces more than enough information that we as citizens, as population, can actually consume. And through effective usage of tech, I think there is a level of responsibility to actually help patients get to the right information at the right point in time, create that level of transparency that they need to have, so that we as citizens feel in control of how our data is being used and what it is being used for, and therefore that have trust, which is quite critical for the success of any capability, any new model, and especially when we talk about something that you can't touch, feel, and it is in the virtual space. Transparency and trust becomes really the building blocks.
Yeah, that's a good topic that you bring up around trust and engagement. I think it's really important because, and throughout today, we've had numerous conversations about data and use of data for population health management, which I'll mention in a second. But I think what comes to mind around that is One London, so the local health and care record exemplar, that's bringing health and social care data together, in a single platform for Londoners. Back in February and March this year, they conducted a public engagement exercise. So there was 100 people, 100 Londoners all come together to deliberate and debate over the use of health and care data. And I think it was significantly positive. The majority was really, really positive about how this can inform policy, etc. So that's a real good news story around the public engagement. And another one that comes to mind is that with the integrated care systems, and I think that this is really important to me, this is close to my heart, because you mentioned population health, and that made me think about the integrated care systems. The integrated care systems have to respond to the long-term plan with their strategy against how they're going to deliver against the long-term plan. So a lot of these strategies have been submitted for review to NHS England, but what was heartening to see is that across the country, Healthwatch, which represents patients and the public, have been engaged in creating these public engagements around what do you want to see from your health economy, how do you want your data to be used. So I think that's been really, really, really encouraging for me to see that, because at the end of the day, if we can help to pull the data together, we help people to use the technology, then population health management will be enabled, because we want to get away from reactionary interventions to prediction and prevention. So that's for me, that's the holy grail for population health management. So yeah. I think we go ahead.
Now, so I was going to say that, look, it is this is an exciting time. I think health industry as a whole has been undergoing transformation, but the wheels of motion are we are on an irreversible path of transformation over coming months and years, and so while if you recall, I was saying that what we saw is that over 80% of the GP patient interactions, primary care patient interactions, were going digital during the peak of lockdown. That has come down now, but it'll. I firmly believe that it's never going to go back to pre-COVID era. So the whole acceptance from whether it is the patients of acceptance for technology, digital channels, etc., whether it is for patients or for healthcare providers. I think that has gone significantly up, and it's not going to. It's only going to get better for the population.
Yes, thank you very much for that, Ashish. And so I think in summary, we've seen a lot of rapid adoption. We think that the conditions are starting to happen. We still have challenges, we understand that, but it's encouraging to see. Do you agree?
Yes, absolutely. If there was a time to be in health sector, this is the one. So super excited.
I agree. Okay, so we've now come to 10 minutes before the end of the session, and we said it would be a Q&A session, so we're going to hand over to yourself, Shona.
Yeah, we've got a couple of really, really interesting questions coming in, actually. So on the trust basis, and Ashish, I'll come to you first on this one. We've got a question which says, how much potential is there to make phone-based track and trace systems permanent in order to catch and prevent the next pandemic early? That's a big one.
So I think it's an interesting one. So I think if you look at it, the core capability that we have, that we see being rolled out, and is phenomenal, and it is phenomenal for not just for pandemic situation. But if you look at long-term disease management, for instance, screening for cancer, earliest possible screening for cancer cases, and taking actions so that the situation doesn't become worse, and those kind of things, the ability to test, trace, track, and act, contain, is phenomenal, right? Conceptually, I have a lot of hopes, actually, that we have gone through some hard and tough times, but the capabilities that are being created, and I think Sir Simon Stevens also said about a month back when he was, I heard him speak, and he was saying that, look, once the pandemic is over, we will have to really leverage the capabilities that are being created during this time.
Can I build on that point, Shona? I think that it's a topic that will go on for forever in terms of debate around the use of tracking and people's phones, etc. But personally, when the app came out, I downloaded it. It helped me. I can check into venues. I can use that, and it's just running in the background. Now, personally, I would rather that contributes to the greater good than we all this lockdown, which is happening across the country. So if we can use the technology, because this pandemic, there's no sign of it going away at this point in time. So if this helps us to carry on and get some form of semblance of normality, then it's a good thing.
Brilliant. And then sort of tracking back to another conversation, that theme that's already come up, and I think you've both touched on it, is around, it's great that we're adopting all this digital technology, but what does this do to the communities that are digitally less able? So either those with accessibility challenges or those who don't have access to technology. There's kind of two groups of those people. There's the all of the staff within the NHS, and then you've got the citizens themselves. So what role do we all have to play in bridging that digital skills gap and access to technology so that we don't create a bigger social economic divide?
Go ahead.
Go on, Steve.
Okay, yeah, just to start off with that, I couldn't attend our session earlier, but we had an accessibility session earlier with one of my colleagues. Microsoft, builds accessibility into all of its products. But I think the question is around marginalized communities. And that brings me back to a point I made earlier. So when I was reading the Health Watch public engagement exercises, developed the health economy strategies, one of the comments were, yes, we understand that you want to use digital services, and I'm okay, I can use a computer, but people down the road from me can't. Can we make sure we just use all channels? So I think it's to use multiple channels and multiple ways of delivering services, online, physical, digital, etc. But I also think that the difficulty will lie in how do we identify those marginalized communities? How can we use, is there anything we can use data to understand those marginalized communities, whether it's economic data linked to postcodes, etc. So the data can tell us, and I suppose if we can understand the population a little bit better, then that's when you can start to target and help those disadvantaged or marginalized communities. So I think we can use the tech to help, identify and target them.
Yeah, and let me build on that. So we worked with NHSX during the peak of lockdown and rolled out a number of tablets to care homes, and where basically elderly were stuck in the lockdown, unable to meet their loved ones, didn't have access to a whole lot of complex technologies that we kind of take it for granted. And again, I keep going back to, yes, it has to be inclusive. We have to remember how we actually simplify things so that people can use it, and we have to create infrastructure for people to use it. So example that I gave you was really a very simple way of helping the elderly actually just simply connect with their families. And that little snowball started to get bigger as they got more comfortable with usage of technology, and then talking to the nurse as well, which was kind of okay because it was not a massive transition. It started with, can I talk to my family and use the technology while I can't meet them? So there are, I think we need to be mindful and take actions while keeping it simple.
Yeah, sorry, but I just want to add to that point, Ashish. That reminds me of, and I do apologise if I get the name incorrect. It was a while ago. It seems a while ago, at the beginning of lockdown. It was Devices.now who were, going around various commercial organisations and asking them to donate devices to them. And we worked with them as well. And the idea was to make sure that for those particular reasons, loved ones, or people you can't go and see your elderly relative, that you could at least get devices to them. So, yeah, I think that was a great initiative.
Brilliant. And so we've got 3 minutes. So I'm going to try and cram a couple of quick fire ones in here now. So short and sweet answers. So how do you see the role that AI in the pandemic played so far, its successes and shortcomings, and how can we build upon that? Stephen, I'll come to you first.
You give me the difficult one, don't you?
Quick fire.
Quick fire. Interesting one. AI. Quick fire could be, I think, in supply chains, for example, PPE, because, if we hit a second wave, then, understanding and predicting where there may be shortages and getting PPE, getting the equipment to the relevant people. AI in terms of the data that's already been gathered into platforms already from various sources to try and understand what's going on with the population, where the hotspots are that Ashish mentioned. So I think, yes, it can and will be used. Shortcomings, I think we just need to make sure that the AI is explainable or has interpretability, and it's fair and it's transparent as well.
Brilliant. And I'm just gonna ask you one more different question, Ashish, because I want to get through as many of these as possible. What are the top 3 things that we've learned over the last 6 months, and what can we do about them going forward? Just solve the country's problems.
Oh my God. So interesting one. So I think top of my mind, I think things, so people are more open to changes than we might think. So we should just go for it. Second, tech is here to stay, and number 3, the changes we have seen, the transformation that we have seen in the middle of pandemic, that's a irreversible trend, and it'll continue. The onus, the responsibility is on us to continue building on it and not just drop the good work that has been done as a foundation once the pandemic is over.
Any last comments, Stephen? We've got
Yeah.
about 30 seconds.
Yeah, for me, I think the trust is developing even more with the private industry and the public sector as well. And I think that's really important because we're all in this together, and it's happening. And it's been really positive and heartening to see the adoption over the last few months. So yes, I agree with Ashish. We can do this. We need to help out. It's a collective effort.
Brilliant. Right, well, we are at 2:00. We didn't get through all of the questions, but I promise that in a blog write-up afterwards, we'll continue that conversation and put those to both Stephen and Ashish. So thank you very much, both of you, for joining us. Thank you, everyone that participated in the session. And thank you very much to CogX for helping us to start to have some really amazing conversations today. So thanks all.
Thank you, everyone. Thank you.
Bye.